Hello students, I am teacher Svetlana, and in our today's lecture we will see about the role of other organs in excretion as well as the disorders and the diseases that are associated with the excretory system, which is all covered in the chapter Excretion and Osmoregulation. So let's begin. Students, let us see the role of skin as an excretory organ. Skin of many organisms is thin and permeable. It helps in diffusion of waste products like ammonia. Human skin is thick and impermeable. It shows presence of two types of glands, namely the sweat glands and the sebaceous glands. Have a look at this image here. You can see here it's marked here. These are your sweat glands, and here you have the sebaceous glands, which are the oil secreting glands. Sweat glands are distributed all over the skin. They are abundant in palm and facial regions. These simple, unbranched coiled tubular glands open on the surface of the skin through an opening called as sweat pore. Have a look at this image here. This here is the pore. Sweat is primarily produced for thermoregulation, but it also excretes substances like water, sodium chloride, lactic acid, and urea. Sebaceous glands, these are present at the neck of the hair follicles. Here, have a look at this image. This is your hair follicle, and you can see here, this is the sebaceous glands, which is present near the neck region of the hair follicle. They secrete oily substances called as sebum. It forms a lubricating layer on the skin, making it softer. It protects skin from infection and injury. Then lungs, which act as excretory organs. Lungs are the respiratory organs. They help in excretion of volatile substances like CO2 and water vapor, which is produced during cellular respiration. This here is the image of the human lungs. They also excrete volatile substances present in spices and other foodstuffs. Now let us have a look at the disorders and the diseases that are associated with the excretory system. Excess albumin in urine, which is called as albuminuria, indicates injury to the endothelial capsular membrane as a result of increased blood pressure, injury, or irritation of the kidney cells by substances such as toxins or heavy metals. Presence of excessive quantities of ketone bodies in urine may be caused due to diabetes mellitus, starvation, or too little carbohydrates in diet. Presence of leukocytes in urine indicates possibility of infection of the kidney or other urinary organs. Kidney stones, these are also called as renal calculi. They may be formed in any portion of the urinary tract, from the kidney tubules to the external openings. Have a look at this image here. The kidney is magnified for you here. You can see here these kidney stones that are there. They can be present anywhere in the kidneys or in the tubules or near the openings. Now, depending on compositions, they are classified into calcium stones, usually are calcium oxalate stones or calcium phosphate ones. Then we have struvite stones. These are formed in response to bacterial infection caused by urea splitting bacteria. They grow quickly and become quite large. Then we have uric acid stones in people who don't drink enough water or consume high protein diets can suffer from this type of stones. Cystine stones, it is a genetic disorder that causes kidney to excrete too much amount of certain amino acids. Now symptoms: intermittent pain below the rib cage in the back and sideways. Here, have a look at this image here. It's highlighted here. This is the region where pain is experienced if a kidney stone is present. Hazy, brownish, reddish, pinkish urine, frequent urge to pass urine, and pain during micturition. That is, there is intense pain at the time of passing urine. Diagnosis: uric acid content of the blood, color of urine, kidney X-ray, sonography of the kidney are different diagnostic tests prescribed depending on the symptoms. The next one, student, is uremia. Blood normally contains 0.01 to 0.03% urea, but if it rises above 0.05%, it is called as uremia. It is harmful and may lead to kidney failure. Next, we have nephritis. It is inflammation of the kidneys. Have a look at this image here. This is how a normal kidney looks, and this is how an inflamed kidney looks. There is reddening of the glomerulus and of the small blood vessels. Now, this is characterized by proteinuria, that is excessive amounts of proteins in urine, caused due to increased permeability of glomerular capsular membrane, permitting large amounts of proteins to escape from the blood to urine. This leads to changes in the blood colloidal osmotic pressure, leading to movement of fluids from blood to the intestinal space. It is reflected as edema, that is, there is swelling and a reddening of the region. Next, we have renal failure. It is decrease or cessation of glomerular filtration. It's classified into two types. We have acute renal failure, ARF. Acute renal failure is sudden worsening of the renal function that most commonly happens after severe bleeding. There is decrease in urine output called as oliguria. So there is scanty urine, less than 400 ml per day or less than 0.5 ml per kg per hour in children. Other causes of acute renal failure may include acute obstruction of both uterus, or we have nephrotoxic drugs. ARF can be detected biochemically by elevated serum creatinine levels. Here is an image which highlights some of the reasons for acute renal failure. You can pause the video for a while and have a look at it. Chronic kidney disease, also called as CKD, it is progressive and generally irreversible decline in glomerular filtration rate, that is GFR. It may be caused due to chronic glomerulonephritis. It can be detected by reduced kidney size and possibilities of anemia. Hemodialysis. Students, when the renal function falls below 5 to 7%, accumulation of harmful substances in the blood begins. In such a condition, the person has to go for artificial means of filtration of blood. You have already studied about hemodialysis, wherein dialysis machine is used to filter blood. Here in this image you can see the automated way of hemodialysis. In hemodialysis, blood is filtered outside the body using dialysis unit. In this procedure, patient's blood is removed generally from the radial artery. It is passed through a cellophane tube that acts as a semi-permeable membrane. The tube is immersed in a fluid called as dialysate. Now here in this image you can see the main parts of the hemodialysis system. So here you have the blood being removed from the arteries here, and then it is passed into the tube that is immersed into the dialysate here. This is the dialyzer. Now, dialysate is isosmotic to normal blood plasma, hence only excess salts, if present in the plasma, pass through the cellophane tube into the dialysate. Waste substances being absent in the dialysate, they move from the blood into the dialyzing fluid. Filtered blood is returned to the vein. So you see, after the dialysis process is completed, then the filtered blood is sent back to the veins, into the body. In this process, it is essential that anticoagulants like heparin is added to the blood while it is passing through the tubes. So here you will see that heparin is being added into the tube. It's an anticoagulant to prevent coagulations of blood. And before resending it into the circulation, adequate amount of anti-heparin is mixed. The blood has to move slowly through this tube. So it has to move very slowly through these tubes, and hence the process is very slow. Then we also have peritoneal dialysis. In this method, the dialyzing fluid is introduced into the abdominal cavity or the peritoneal cavity. Have a look at this image here. This is your dialyzing solution. It is directly introduced into the abdominal or the peritoneal cavity. The peritoneal membrane acts as the semi-permeable dialyzing membrane. So this is your peritoneal membrane, which is acting as the dialyzing membrane. And we have toxic waste and extra solutes pass into this fluid. This fluid is drained out after the prescribed period of time. Have a look at this image here. The entire process is described for you. Here you have this is a bag of dialysate, and it is connected to a tube into your abdomen, and then we have your abdomen is filled with the dialysate. Now, waste fluids and chemicals flow through the peritoneal membrane into the dialysate. So it flows here and it mixes with the dialysate. About 2 to 3 liters of liquids are used in each exchange. Then we have here, see, after a few hours the dialysate is drained out of the abdomen into an empty bag. We also have fresh dialysate ready to fill your stomach. Peritoneal dialysis can be repeated as per the need of the patient. It can be carried out at home, at work, or while traveling, but it is not as effective as hemodialysis. Also, students, kidneys are associated with secretion of erythropoietin, renin, and calcitol, which is not possible using dialysis machine. So the dialysis can help in filtration of the urine and perform a partial role of kidney, but it cannot replace all the functions that the kidneys perform in a human body. Kidney transplant, it is organ transplant of healthy kidney into patient with end-stage renal disease. Kidney transplantation is classified as cadaveric, that is a decreased donor, or living donor kidney transplant, and living donor kidney transplant is further classified as genetically related, living related, or non-related, living non-related transplant. So here is an image to give you an idea of what happens in kidney transplant. Here you have the donor kidney, which is healthy and normal, and it is introduced into the recipient who has the diseased kidney. So this is the transplanted kidney that is introduced. Thank you, students, for participating in this lecture. See you soon again with the next topic. Till then, take care, be safe, and keep learning.